had some questions about students and just needing some advice for their clinicals going into for the first time, and just some tips and pointers. So one really important thing is to try to take initiative. I know it's hard and scary going into, first you're going into a new field, a new career that, that's scary in and of itself. And then you're going into a new facility with people that you don't know. So you're brand new and you're a student. And so I can understand the intimidation factor behind that. But irregardless, you should always go in taking initiative. A phrase to never use is "I know." Take that out of your vocabulary. I'm an over-communicator, if you couldn't tell. So I'm going to talk to you about everything. I'm going to ask you what level you're at, how you feel, how comfortable you feel with the case, what you think you're going to need, how much help you want from me, where you want me to stand. Some preceptors aren't going to communicate with you as well as others. Which is just, it's their personality. They may have a certain expectation of you and just not necessarily know how to voice that. So in those situations, ask questions, because the preceptor may just assume that you are unwilling to do certain things, but you might assume that the preceptor doesn't want you to do anything. Hey, is it okay if I scrub in? That is never a bad question. What's the worst that they can say? No? All right, that's where you were anyways. Hopefully your clinical coordinator is choosing preceptors that will allow you to scrub in. Some don't want you to scrub in at first because they're nervous about you contaminating. It makes you nervous because your preceptor's nervous. I understand that. If you go into it trying to communicate as much as you can and show your willingness to learn, it's very hard for someone to turn that down. But no, most of the time, it's just a big miscommunication between you and your preceptor, where nobody's really talking and both of you are kind of assuming the other feels a certain way. So just express what you want to do. Hey, can I scrub in? Ask questions and take the initiative. Then you don't have to sit there and wonder.